Hi, I'm Morgan Vaughan. This is Facts at 5. It is Tuesday, April 14th, 2020, and I'm here again with Chrissy Sampson from the East Hampton Star.
Hello, Morgan.
Hello, Chrissy. Okay, so we've been talking the past couple days about masks, and our ultra-local news was that they were thinking about requiring it. Now Governor Cuomo has said that effective tomorrow, Wednesday, April 15th at 8 p.m., all essential businesses or entities shall wear face coverings when in direct contact with customers or member of the public. Businesses must provide at their expense such face coverings for their employees.
So we knew that Southampton Village a couple of days ago started mandating face masks in grocery stores. And then 2 days ago, East Hampton Town Supervisor Peter Van Scoyoc said, we are recommending everybody wear masks when they're outside. Now we have this mandate from Governor Cuomo.
This is an executive order.
It's an executive order, meaning this isn't an option right now.
Right.
And so the other thing is that I know that Southampton Village Mayor Jesse Warren on Twitter today said that he has some of his village staff going out and delivering masks to people who need them.
Oh, wow.
He will deliver, if you message them on Twitter or social media or call their, call the town village, they will deliver you masks, even if you're not a Southampton Village person.
Oh, wow.
So that's a very great gesture. But the other thing is that, now businesses have to provide masks to their employees. So we're going to start seeing what that looks like in the next few days.
Well, I know that in East Hampton Town that there are now collection boxes at Panago Road, on Town Hall and Panago Road. I think we might have talked about this yesterday. And at the police station in Wainscott, where you can donate for grocery store workers, et cetera. So that, and I think that's on the emergency crawl. And I put that was from a press release on Saturday, I think, from the East Hampton Town. So now we have a place to donate, and everybody has to wear a face mask.
Yes.
Okay, so Suffolk County statistics.
So we are at a rate every day about between 42 and 44% of people who are being tested for COVID-19 are turning up positive.
Okay.
So in that we have tested about 52,300 people. Now 42.9% of them are positive. That means 22,691 people have tested positive. Now, that's an increase of about 700 from yesterday. But in the past few days, weeks, we've been seeing increases of 1,000 or more, which we actually have a chart from Suffolk County showing exactly what Suffolk County Executive Steve Bellone has been talking about, in that the curve may be plateauing at this point.
Okay, which we can see because the exponential curve would go straight up, and this plateau curve is sort of like almost like a wave.
Yes, it's been described as a wave by Governor Cuomo as well as a curve. We've been trying to get some folks on here to talk about that. It's hard because, you really have to have an expertise in exactly what exponential growth will show, and the models and the projections differ literally from day to day, especially when you listen to Governor Cuomo's fireside chats every morning.
Well, I was listening to a scientist talk about why exponential growth is difficult to talk about, and it's almost like when we start talking about the stars and we start talking about enormous numbers in the universe, our brains just kind of freeze.
Yeah.
It's very difficult to understand that kind of growth. But this, in response to what we just saw, it looks like hopefully there is a plateau happening.
Right, and that's not to say we should be releasing or letting up on any of the important measures we've been taking, social distancing. All of those things are still really important.
Well, in fact, Governor Cuomo just provided a new executive order saying the exact opposite. Now we're actually going further.
Right. And so here in East Hampton Town, just to bring it back to the numbers for a minute, we have reached 100 cases in East Hampton Town. There's a chance that this is being underreported. And Steve Bellone, our county executive, was just on the phone a little while ago talking about this, in that the county hasn't really had a good system to record and document people who have two addresses.
Oh, okay.
So
interesting.
There could be more cases here than we are aware of, because somebody might not be reporting their primary address as East Hampton, but they have a house here. And that is something that we've talked about for a while now.
Right. Well, and also we keep mentioning this, but it's so important to say that just because you were tested does not mean that you just because you could have not been tested and have COVID-19.
Exactly.
And so these numbers are a little weird anyway.
We have an increase of 40 people who died in the last 24 hours. That brings us up over 600.
Wow.
And there is a silver lining here. We are seeing hospital discharges. 108 patients have been discharged from the hospital in the last 24 hours into continuing their recovery at home. And I have an answer for you, Morgan. So yesterday you asked how much bigger Southampton Town is compared to East Hampton Town, because we knew that the Southampton Town statistics had been higher consistently than East Hampton Town. Here's an answer. According to the American Community Survey, which is a less comprehensive version of the census and is 2 to 3 years old at this point, Southampton has about 56,700 people year-round, whereas East Hampton has about 21,400 year-round residents.
Oh, okay.
So it is a difference there, quite a big difference. This is according to data. The American Community Survey data is released in April.
Okay.
And it was last released in 2018.
So East Hampton Town really has about a third of the residents of Southampton, roughly.
Roughly. And, when you talk about population growth in the summer, there still isn't a really good way to measure that.
Right.
As we were just discussing.
Right.
But speaking of the census.
Oh my goodness. So I'm a genealogy and history person. So I love looking at census data. The census is happening. I feel it unfortunately has been completely usurped by the coronavirus, but that is why they have extended the deadline to reply to the census as of August 14th. Now, we know, presumably this takes place every 10 years. It is incredibly important for public data, including voting, including a gazillion things. It is very, very important that we do this. It's how legislative districts are created. It shows how the federal government knows how much money to give for healthcare, education, infrastructure, other services. It is so important that you fill out your census. You can do it online, by mail, or by phone, and you can go do it at the website, which I did, which is 2020census.gov. It is, now here's something super important to understand. There's no citizenship question on the census, and regardless, it is a rule that the U.S. government cannot release personally identifiable information about an individual to any other individual or agency until 72 years after it was collected. So in other words, the information that I gave today or yesterday or wherever I did the census is not going to be available to anyone for 72 years. I mean, except for the federal government. All right. So this is to provide statistics. I encourage everyone to do this. If you go to the census, 2020census.gov, it is in all the languages you can imagine, and it is just incredibly important.
It's also fairly easy. I actually did it the other day.
Easy.
And, it was easier than I expected it to be. But there's no citizenship question, but there is a question about your race and ethnicity, and that's a required question. You can't skip it.
Okay, but still, that's an important thing for them to know eventually just for data that we have, yeah.
Yeah.
I just think that people are scared of doing that because they don't want to be, a lot of people are worried about, yeah. However, we need to do this. Okay, here's fun news.
Here's something you need to know.
No more coronavirus. Let's talk about Lyme disease now.
Yes, well, tick bites, health professionals are saying tick bites are going to pose an even more serious health issue than they have in the past. This is from Dr. George Dempsey of East Hampton Family Medicine. He's been reaching out to the local media to give a warning because so many people are going outside to get fresh air these days. They're taking nature walks. They're getting on their bikes and taking a ride through the woods. Dr. Dempsey is an expert on tick-borne diseases, and he is putting out a warning that if you get a tick bite, it will be even more challenging to figure out if you have a tick-borne sickness versus COVID-19 symptoms because symptoms overlap. Right. There are, you could have a fever, you could have respiratory symptoms or headaches from tick illnesses, and some of those factors, some of those manifests itself overlaps. The best thing to do, Dr. Dempsey says, is to save the tick. If you get a tick on you and it bites you and you remove it, save the tick, put it in a plastic bag, and keep it until it gets tested. He told me yesterday, we will figure something out to get people information. You know, he'll do a telehealth visit after they've tested your tick. Maybe you can hand it to them through the plastic sheet that is at East Hampton Healthcare Center. The other important thing to do is be really careful when you're taking a walk outside. Be mindful of ticks. Wear that light clothing and shoes so you can identify a tick if it's on you. You can even use permethrin spray to spray your clothes. Don't spray your skin, but spray your clothes. Also note that it is toxic to cats, unfortunately.
What is it called? What spray?
Permethrin.
Okay.
And you can get it like hunting supply stores usually have it. You can get it on Amazon, although it may not get here for another month.
Right.
But, you know, that's an important thing to know. And the Southampton Hospital Regional Tick Research Center, that is still operating. That number is 631-726-TICK.
Okay.
And so you can still call that number if you need help and advice on a tick issue.
I think that's a really good advice because people might present with exactly the same symptoms. So this is good to be aware that you could possibly have a tick-borne illness. There's a need to know how to help from the Hampton Child Care and Recreation Center, that they are providing families with food and with online tutoring and with providing computers of their own for families. If you can donate, please do so at bhccrc.org. And speaking of that, their subject of the day, and we don't have a lot of time, but quickly, is parenting. And I noticed today on John Germain Library that they have a parenting group that they're starting up. So if you need, you can go and look at this. It's a Zoom meeting. Through a weekly Zoom meeting, parents can come together in a judgment-free space to find a supportive community as we all navigate this challenging time for parents with children at home. I asked some of my friends, and I got some suggestions from real parents. One was for her 3- and 6-year-old Cosmic Kids Yoga from YouTube. 2 people suggested, and I thought this was so interesting, paper books. That 3 30-minute segments of reading a paper book unrelated to schoolwork. No screens 1 hour before bedtime. Another person talked about paper books because we're just, everybody's coming at us with technology. Another person was talking about the free Scholastic site Spring School is set up. A lot of people are trying to figure this out as they go. And speaking as someone who, my kid is in college now, but I can't imagine right now going through what we're doing and having to watch someone else's growth and learning. And I really, hats off to all the parents who are doing that. It is incredible. Here's another resource. Have you seen this? It's called livebrary.com. And it is go to livebrary.com, and it is all the libraries in Suffolk County. You can find your library, take up books, do whatever. What the libraries are offering right now is unbelievably amazing. So huge shout out for that. All right, good news.
Well, we've heard from Southampton Hospital. They put out a call for kids to share their artwork, and they received dozens of replies. This is really lovely. They put this video together because visitors have been prohibited at the hospital right now in light of the virus, and they wanted to still find a way to promote that good cheer and that sunny feeling in the hospitals. So the outcome is a really lovely video called My Happy Place on the East End. And it is like 3 minutes of children's artwork, and it is beautiful. It brought tears to my eyes when I was watching it today. You can search for it on YouTube and Facebook. My Happy Place on the East End. Thank you, Southampton Hospital.
And that's Stony Brook Southampton Hospital.
Mm-hmm. Stony Brook Southampton Hospital.
And tomorrow, Angela LaGreca has interviewed Barbara Jo Howard, who's the Marketing and Communications Director at Stony Brook Southampton. So that will be tomorrow, the interview tomorrow. But as for today, I think that's a wrap. You got anything else, Chrissy?
No. I usually say wash your hands, but everybody knows that by now.
Put on your mask.
Put on your mask.
Put on your mask, wash your hands, and stay safe and stay home.